Hey everyone, welcome back to my channel. My name is Kelly. I am a physical therapist as well as a certified lymphedema therapist. Today in this video, I'm going to go through an entire manual lymphatic drainage routine or lymphatic drainage massage for the left leg. Manual lymphatic drainage is a component of complete decongestive therapy, which is used to help manage and reduce swelling or lymphedema. It may also be used for lipedema, other vascular issues, or really just lymphatic health in general. This routine will be from start to finish that someone can follow along with. To see other videos related to lymphatic drainage as well as other components of complete decongestive therapy, be sure to subscribe down below. You can also follow along with us on Instagram to see other related content. I'm going to be doing this routine laying down with my legs up on the bolster, up in the air. It is ideal to be doing this laying down because gravity can assist with that fluid moving up and out of the leg, but for some people that's not realistic and they need to do that sitting. Any sort of movement and working on the tissue is better than nothing, so find what position works best for you. Lastly, before we begin, make sure that you check with your doctor for clearance and your certified lymphedema therapist for any personalized guidance. So the first thing we want to do is stimulate the lymph nodes in your abdomen. You have a lot of lymph nodes deep in your tummy, and all of the fluid from the legs has to go through the abdomen to get out of that area. So we want to make sure that we're decongesting this area before moving on to the legs. So what we're going to do is think of the abdomen in 4 equal quadrants. We're going to put our hand on the belly, gently press in, take a nice deep breath in, feel your belly expand, and breath out. Move to the next one and breath in and out. The third one, breath in and out. And last one, breath in and out. Good. Next, what we want to do is stimulate the other lymph nodes in the body. We want to stimulate the head and neck lymph nodes as well. So we want to think about around the clavicle or collarbone and the sides of the neck. If I take my whole hand and place it down on that clavicle or collarbone, we're going to do large circles in that area. We'll do about 8 to 10, and we'll do the same thing on the other side. Large circles. And then same thing, we have lymph nodes that are right below our ears, so we're going to put our hands right there and do nice circles there. We just want to make sure that we're stimulating all the major lymph nodes in the body to help with decongestion through the legs. From there, what we want to do is stimulate the other lymph nodes in the body that are going to help from the left leg. And so if this area, the left hip or the left groin or the lymph nodes there are compromised, which is causing lymphedema, we want to try to move the fluid either to the right side if it's not compromised, or we want to move it up to the left armpit. So if someone has both legs, we don't want to move over to the other side. Everything needs to go up, but we want to make sure we're stimulating those lymph nodes. So we're going to start in the arm, take the whole hand, put it right in the armpit, and we're going to do nice large circles there, 8 to 10 of them. And the lymph nodes are right in the armpits. You don't have to press really hard. And then after that, we want to go over to the right groin area, right where that crease is when you sit, and put your hand there, ideally directly on skin, and do large circles in the right side. After about 8 to 10, we're going to go over to the left groin lymph nodes, the inguinal lymph nodes, same spot, right where the crease is, and we'll do 8 to 10 circles there. After we've done that, we want to try to get rid of any swelling or backed up fluid that is right around this area. And so we're going to go from the left groin area to the left armpit. The lymph vessels are up the side of the body, and so what we're going to do, again directly on skin if able, is to start doing the strokes up the side from the left hip region up to the left armpit. We're gonna go about 3 to 5 times. And after you've done that, same thing, we're gonna go from the left groin to the right. If someone has swelling on the right side, they will skip this part. And so across the abdomen from left to right. Can either push across or pull, but 3 to 5 times across or more if desired. And after we've done that, we're going to start moving into the left leg. Now, if someone is able to roll on their side and reach around their hip, that would be another area to get, or on the low back. For a lot of people, that is difficult to reach. But if we are, the lymph vessels from the glute area, the bottom area, do wrap around towards the front. And so what we're trying to do is wrap up and over from the back of the hip, or if someone's able to reach their low back, up and over from there. After doing 3 to 5 strokes in those areas, again reaching as far back as someone is able to, we're going to move back towards the front of the hip. From here, we like to think about the leg into different sections. So we think about the thigh section, the lower leg, and then the foot and ankle. And we want to work from the top, working our way down, because we want to decongest this area. If we start from the bottom and work our way up, it's just going to be clogged. So we'll work our way down and then we'll work our way back up. So we're going to go to the thigh. We want to think of front, outside, inside, and the back of the leg. And we'll do about 3 to 5 strokes or swipes all the way from the knee area to the hip or to the groin area on all 4 sides. So using as much surface area of the hand as possible, gently giving the skin a stretch, and then moving on to the next one. And I'm going to do the inside and the outside at the same time. But whatever someone can reach. As you get to the inside of the thigh, you want to think about the lymph vessels do start to wrap towards the front. So we are trying to think about wrapping a little bit more towards the front rather than just straight up. But 3 to 5 times, bring it all the way in. If someone has fibrosis, which is that kind of hardened, thickened area or tissue, that means swelling has been there a while, the lymphedema can cause that. Then I may stop and do a little bit of deeper massage, kind of thinking about kneading dough is usually what I like to say, but grabbing the tissue a little bit more and trying to massage it out to soften that area, because fibrosis can clog the pathways a little bit further. So if we can massage it out for a couple minutes, soften it a little bit, then we will go back with the strokes to try to move the fluid down and out of this leg. So we've done the front and the sides, we're going to work towards the back. And again, it does wrap around towards the front. So I'm kind of working my way around as I go. 3 to 5 strokes, or as much as someone would like, depending on how severe it is in that region. And after we've worked through the whole thigh, then we're going to go around the knee. So we do have some lymph nodes that sit right behind the knee, and so we can do some small circles there. I do have my leg up on the bolster to try to help with gravity. Some people can hold their leg up in the air, that's fine, and some people will have to do this in sitting, which I have done in the other video, and that will work just fine as well. After just doing the circles in the back, I'm going to work in the front of the knee as well. So we have a lot of bony areas in this region, and we want to kind of work around the bones because the fluid likes to sit in those crevices. So spend a little time around the knee, working around the kneecap, and the sides. And you may want to go back to the back of the knee, getting around those tendons, those hamstring tendons. And after you've done some strokes there, we're going to go on to the lower leg. And so we're gonna work from the ankle to the knee. Again, some people have to cross their legs, some people have to do this sitting up, some people can do it with their leg in the air, whatever works. But we're gonna work from the front, working our way up 3 to 5 times with the short strokes, giving a gentle skin stretch. And after 3 to 5 there, we're going to work to the outsides and the insides, or one at a time, whatever works. As much surface area again of the hand, or with the hand as possible. Work our way up. And after we do that, we're going to work in the back where the calf is. This is another area that likes to get a little bit thicker with fibrosis or hardening. And so if we do, what we'll do is just gently massage that area that might be firm. Think about kneading the dough. Spend a little time there, a couple minutes there or more. And after you've softened it, then we'll go back and still finish with more short strokes to get that fluid moving through that hardened or fibrotic region. Good, so after we've done the lower leg, we're gonna go to the foot and ankle. And so I will work on the top of the foot. A few strokes there, you can work on the sides. The other area that likes to hold swelling is right around the malleoli bone. So these bones on the inside and outside of our ankle, we wanna make sure that we work around those bones. Spending a little extra time there. And after we've done that, around the foot, we can go to the toes. Some individuals have very minimal swelling, so they can just do all the toes at once. Some individuals will have to go each toe separately. If you have the time, that would be the most thorough. So working through each toe, making sure you're getting the sides. And after we've made our way all the way down the leg, gone through all the toes, then we're gonna work our way back up the leg. So we worked our way down, we're gonna go in reverse. And so what we're gonna do is go back from the toes to the foot. And then what we'll do is go back to behind the bones. And then go back to the lower leg. Working 3 to 5 strokes on each side. Inside and outside. And after we've done the front and the inside and outside, we're going to go back to the back. And after we've done 3 or 5 there, or more if someone needs it, we're gonna go back to the knee area. So I'm gonna start behind, working around the tendons. And then I'm gonna work around the kneecap. And then I'm going to go back to the upper leg from the knee to those lymph nodes in the inguinal area or the groin area. And everything working towards the front. And feel free to stop for any harder or thicker areas or that fibrotic tissue. Spend a little more time working there. I'm going to work around the back, working around towards the front. And after you've spent as much time as you need on the thigh, working up towards the front, we can go back towards the side of the hip, if you can reach, or the side of the low back. And you are welcome to roll over onto your side, or if you're sitting, just scoot to the side, but wrapping around towards the front. And from the low back and around if needed. And after we've made our way all the way back up here, we don't want the fluid to stay here, so we want to start to move it back up towards healthier lymph nodes, either on the right side or the left armpit. So we're going to work this across from the left to the right. Three to 5 times. Again, if you have a right side that's compromised, we don't want to go this route. What we'll do is we'll go straight up. So either way, from the outside, from the left to the right arm, or excuse me, to the left armpit. The vessels run right on the side of the body, not in the front, so try to really reach as far over to the side if you can. Or if you are working on someone else, just stay on the side. 3 to 5 times directly on the skin if you are able. And after we've gone and moved all this fluid up, we're going to finish with our belly breaths. We're going to go back to the 4, think about 4 quadrants, put your hand on the belly, take a nice deep breath in, feel the belly expand into the hand, but give some resistance. And relax. Next one, breath in and out. Third breath in and out. Last one, breath in and out. And that's it. Like I said, I have created a lot of other videos on complete decongestive therapy that you can check out on my channel, and be sure to subscribe to see when the next videos come out. And I'll see you all next week for another video. Thanks, everyone.